Another diagnosis that has also been used and is delusional disorder persecutory type, because when the alienating parent persuades the adolescent to believe in false information and feel almost paranoid toward the target parent and act out their paranoia, this diagnosis qualifies for either the alienating parent or the adolescent. Another diagnosis is partner and spouse abuse. It's very important to note that. So psychological test questionnaires have been developed to fine-tune the diagnosis to help us understand what's going on in the system. And we as providers treating the adolescent or the family cannot leave this dynamic or diagnosis out of the goal treatment planning. Even if you're a worker, Salvation Army worker or social services worker or any human services or any provider, even in an educational setting, it's important to keep that as part of the assessment, because more damage can be done if we leave the alienation out of the treatment plan, which means the alienating parent continues their behaviors and the goals are not met. And indirectly, the adolescent suffers and the target parent suffers. So as providers, we cannot have a casual attitude about what's happening, the conflict, because it is calculated and willful behavior and non-compliance about court orders, but non-compliance as a parent to have a responsibility, and it ultimately leaves the adolescent helpless and powerless in this situation. The boundaries that professionals need to keep are critical, because it's so easy to get caught up and overstep our boundaries of knowledge and to pick one side over the other. So it's so important to withhold judgment, be open to getting more information, more sources, and curious, and withhold judgment and not polarizing the situations, good or bad, because there is truth. There is true information if we look for it. So professionals continually, I'm hoping, can do due diligence in getting the real picture of the family situation and do something about it, because parental alienation is psychological maltreatment and educational and medical neglect, because one parent refuses to provide for those needs to the adolescent.